Hello, I'm Dr. John Feller. I'm the Chief Medical Officer for Halo Diagnostics. And I'd like to talk to you a little bit about a new type of therapy called focal therapy for prostate cancer. The standard of care for detecting prostate cancer currently includes getting a screening serum PSA followed by a multiparametric MRI in patients with an elevated PSA, and in patients whose MRI is abnormal, then having an MR-targeted biopsy of the prostate. In a subset of men who have clinically significant prostate cancer, confirmed with these standard of care detection techniques, they can go on to image-guided focal therapy. In our case, we do MRI-guided laser focal therapy. This is done under an IRB-approved clinical trial, so it's not yet considered the standard of care and is not reimbursed by insurance, but is being performed for investigational purposes. We at this point have 10 years of follow-up in almost 200 men, where in an outpatient setting, we've used MRI-guided laser focal therapy to safely and precisely treat prostate cancer that's intermediate risk and is confined to the prostate gland and hasn't spread anywhere else. Now you may ask yourself, well, what is the advantage of this MRI-guided laser focal therapy? The big advantage is that our cancer control is very, very similar to if the man had whole gland therapy, such as radiation therapy, or surgical removal of the prostate gland, which is called a radical prostatectomy. But the patients who have whole gland therapy are at significant risk of getting side effects. Up to 50% of them can get erectile dysfunction, and up to 25% of them can get urinary incontinence. In the 10 years that we've been following our patients that have had MRI-guided laser focal therapy, we have not seen any statistically significant erectile dysfunction or any significant urinary incontinence. So the bottom line is, with this new type of MRI-guided laser focal therapy, we can safely treat some forms of prostate cancer, have similar cancer control to if the patient had the prostate surgically removed or had radiation therapy, but at the same time we eliminate the side effects of whole gland therapy. No erectile dysfunction, no urinary incontinence.